I will be demonstrating the 4 Leopold's maneuver in the Obstetrics Skills Lab. This is a birth simulator or sim-mom. Leopold's maneuvers are 4 specific steps in palpating the uterus through the abdomen in order to determine the lie and presentation of the fetus. Before proceeding with the maneuvers, I will show how the sim-mom works to elicit the maneuver. The abdominal wall can be lifted. Within lies the fetus in a longitudinal lie, cephalic presentation. The cushion below can be inflated so as to elevate the fetus and give the real feel through the abdominal wall. The abdominal wall is trapped in position. Before proceeding with the Leopold's maneuver, explain to the patient what the examination involves and why it is necessary. Obtain a verbal consent. Patient should have an empty bladder. Ask the patient to lie in the supine position. Expose the abdomen from xiphisternum to pubic symphysis. Cover the upper and lower parts of the body. Flex the legs at the knee joint and slightly abduct so as to relax the abdominal wall muscles. The first Leopold maneuver, also known as the fundal grip, is done by facing the face of the patient. Palpation is done by placing both hands on top of the uterus, that is at the fundus. It is laid flat, and identify the pole of the fetus lying at the fundus. A smooth, hard, globular ballotable mass is suggestive of head. A soft, broad, irregular mass is suggestive of breech or buttocks. In a transverse lie, neither of the fetal poles are palpable in the first Leopold maneuver. If either the head or breech of the fetus are at the fundus, then the fetus is in a vertical or longitudinal lie. The second Leopold's maneuver, or the lateral or umbilical grip, the palpation is done facing the patient's face. Place both hands on either sides of the umbilicus to palpate the back and limbs of the fetus. Keeping one hand steady, the other hand palpates gently. The back is suggested by smooth, curved and resistant feel. On the other side, you may feel the limbs as knobby structures which are irregular parts. The position is determined by noting the back, whether it is placed anteriorly or towards the flank. The third Leopold's maneuver, also known as Pollock's grip, is done facing towards the patient's face with an outstretched right hand which is placed over the lower pole of uterus, keeping the ulnar border of the hand on the upper border of pubic symphysis. The thumb and fingers of the hand grasp the presenting part and test the mobility of the fetal pole. A hard, smooth, globular mass which is ballotable represents a non-engaged head. A soft, broad, irregular part represents the breech of the fetus. In a transverse lie, the Pollock's grip or the third Leopold's maneuver will be empty. So you confirm the lie, the longitudinal lie, and also the presentation of the fetus in the third Leopold's maneuver. The fourth Leopold's maneuver, or the pelvic grip, is done facing the patient's feet. The 4 fingers of both hands are placed on either side of the midline in the lower pole of the uterus, parallel to the inguinal ligament. Apply gentle pressure in the direction of the axis of the pelvic inlet. The fingers are pressed downwards and inwards in a manner of approximation. If the fingers converge below the presenting part, that is the head or breech, it is not engaged. If the fingers diverge, the head or breech is engaged. The attitude of the head can also be inferred by the fourth Leopold's maneuver. This is done by noting the relative position of the sinciput and occiput prominence. The occiput lies on the side of the back of the fetus. If the occiput is at a lower level than sinciput, the head is well flexed, that is vertex presentation. Sinciput and occiput at the same level signifies a deflexed head. If the occiput is at a higher level than the sinciput, it signifies an extended head or face presentation. So with this, you can confirm the longitudinal lie, presentation, engagement, and also the attitude of the fetal head. So with this, we have completed the 4 Leopold's maneuver, and after completion, need to cover the patient